So in the last 2 weeks, I've had a patient who was younger than 40 diagnosed with colorectal cancer. Colorectal cancer is sometimes called colon cancer or sometimes called bowel cancer, depending on what country you live in. But they're all referring to the same thing, and that is a tumour growing in the large bowel. And although we have made really quite exciting inroads in terms of using screening for cancer of the colon in older patients, and we have made progress in terms of finding cancers at an earlier age using that screening progress, what has really come as a bit of a shock to me is just how much cancer rates have increased in much younger people. And if we look at the statistics in America, I know that we've got a global audience, but a lot of the research is in America, but I think, certainly we're in Australia and we eat probably quite a similar diet, and our rates are often very similar for diseases. We have seen that there has been an almost doubling of the rate of colorectal cancer in the under 40s in the last 20 years. And it's predicted that by 2050, colorectal cancer will be the number one cancer cause of death in both men and women. And it currently sits at number 2 and number 3 for men and women in terms of cancer. It's definitely a cancer that is one that can be tricky to diagnose at an early stage. And it's one of those interesting cancers, if we think about how we believe it develops. The lining of the gut is something that's constantly growing and shedding, and we pass out the lining of our gut when we go to the bathroom, along with the food that we haven't completely digested. And what we believe is that in some situations, there is tissue that doesn't shed, but in fact begins to overgrow. It then initially becomes a polyp, which is a benign tumour, and then some of these tumours become cancerous. And the tricky thing is that often by the time you've got to the point where you've already got a cancerous tumour, the potential is that you may well have got spread of that cancer through the bloodstream, and those cancer cells may well have implanted themselves somewhere else. So the ideal thing, of course, is that we either screen and find it early, or we, in fact, try and prevent it in the first place. And we know there are definitely some genetics involved. There are families who have certain genes and very, very high risks of developing lots of polyps in their colon, and they're very high risk of having colon cancer, and they're often in screening programs, and they're usually quite aware because of how many members of their family may be troubled. But what's probably a little more challenging is people who just know that they maybe have, an auntie or an uncle or a grandparent or something that they know vaguely might have had cancer, but they're not entirely sure of the details. Interestingly, because of this change in the demographic that we're seeing with colorectal cancer, a lot of countries are moving to changing their screening program. So depending on the country you live in, often the initial screening is using a stool test or a poo test, which is sent off to the lab. And often we are looking just for some microscopic blood within that sample. And the reason that we're doing that is because you shouldn't really have any type of blood in your stool. And if you do, it may be an indicator that you have a tumour or a polyp that's bleeding in your gut. And if that comes back positive, then the next step would be for you to go and have a colonoscopy. And a colonoscopy, for those who aren't sure what that actually means, is basically the day before you stay at home, you take a very strong laxative. It's not the funnest day of your life, it has to be said. You keep drinking fluids until everything you're passing out from your rectum is clear. And you then usually go to a clinic or a hospital. You're given a sedative, and either a gastroenterologist or a surgeon will complete a colonoscopy, which involves them putting a flexible camera into your rectum, which they feed up through the gut. And they're basically looking with direct vision through a camera and then watching on a screen to see whether they can find any polyps or anything abnormal looking within the gut. Obviously, there's other causes of bleeding or blood in the poo, but I'm not going to talk about those today. So what can you do to prevent this, and why is it happening? Well, the reality is that the jury is definitely still out, But there is certainly lots and lots of studies going on at the minute to really try and understand why are we seeing this shift and why are people having colorectal cancer at a much younger age. The things that we definitely do know is that people who have high levels of insulin or insulin resistance and diabetics are at increased risk of colorectal cancer. And we also know there is a direct link to people who've had a lot of antibiotics in childhood and early adulthood. So that gets us then to that gut microbiome, or the bacteria that we know that sit within the gut. And there are animal studies at this stage that we know if they detect certain bacteria within various mice studies, they can actually give the mice colorectal cancer, and then they actually can also manipulate that colorectal cancer with other bacteria. And this is definitely still at a very early stage of research, but it's certainly very promising, and it certainly does seem like it's, very indicative that there's probably something going on within the gut microbiome. So what can you do to reduce your risk of colorectal cancer? Well, there's a few things that we definitely do know for sure. A bad diet increases the risk of all forms of cancer. But what we know with colorectal cancer is that red meat and processed meats seem to be extremely problematic. We don't entirely know why. We think it's probably something to do with the nitrites in the preservatives that particularly used in things like sausages, bacon, salami. But we also know that the cooking process is also a problem. So if you're charring your meat or cooking it at a very high temperature, it does produce chemicals that are carcinogenic. We also know that red meat actually alters the gut microbiome, and it seems to alter it in quite an unhelpful way and produce more sulfur producing bacteria within your gut, which seem to be carcinogenic as well. So certainly one of the recommendations is that you really reduce your amount of red and processed meats. And certainly the WHO have ranked things like bacon as being really high level carcinogens, which is a real shame because I absolutely love bacon. Second thing that you can do is decrease your alcohol intake. So a lot of people know that alcohol is related to things like liver cancer, but not a lot of people seem to know that it actually is quite strongly correlated with both colorectal cancer and also breast cancer. And we don't entirely understand the relationship or if there is in fact any safe level of alcohol, as it does seem that even one alcoholic drink per day does seem to increase your risk in somewhat of a linear fashion. But again, we're still doing lots of research about that. We also know that if you have more whole grains and fiber in your diet, that seems to decrease your risk of colorectal cancer. And there's been lots of studies and lots of hypotheses about why this might be helpful. Certainly those items within your diet increase and speed up the amount of transit time, decrease the transit time, so it makes the stool move more quickly through the gut. And there's also a theory regarding gut microbiome again, because the gut microbiome being healthy seems to be very, very reliant on things like fiber. The other thing is, and it's one thing I find a lot, is sometimes patients like to have an antibiotic just in case. They maybe have an illness that I'm really quite certain is a viral illness, but, perhaps it's been going on a lot longer than they want, and they maybe are really keen to get back to work or for their symptoms to go away. And sometimes, as doctors and GPs, we feel like we're sort of stewards of antibiotics, and it's just one of the reasons I'd love people to understand is why we don't want to always give you an antibiotic is, first and foremost, it's not going to help you if you've got a viral illness. But we also now really understand that if you take a course of antibiotics, it completely disrupts your gut microbiome, and it can take months and months for your gut microbiome to reestablish itself. And as I said earlier, we know that people who've taken a lot of antibiotics in childhood and early adulthood do have an increased risk of colorectal cancer. And again, we need to clarify where we are with that. So I suppose I would really ask you, just only use antibiotics whenever your doctor really thinks they're necessary. And that's not to scare someone from taking an antibiotic. Obviously, at times they're absolutely life-saving, but it's just we don't want to be taking them willy-nilly. And the last thing that you can do is physical activity. We do know that there is higher rates of colorectal cancer in people who are overweight or obese, but no matter what your weight, the more physically active you are, the more you reduce your risk of having colorectal cancer. So as I said at the beginning of the video, in recent weeks, I've had a very young patient who has really been quite shocked by their diagnoses. Obviously, it's important if you have any symptoms, so a change in bowel habit, bleeding, noticing blood in your poo or noticing blood coming from the back passage, weight loss, or any kind of change in, abdominal pains or feeling really full whenever you're eating, you definitely want to be talking to your doctor. But what we really want to work on today is how we can prevent it. And hopefully those tips that I've given you are going to help. Thank you. When I started this podcast back in December 23, I knew that I was lucky enough to have amazing conversations with various health professionals across all facets of medicine and allied health. And I knew that you would probably really enjoy being a fly on the wall to hear what we talked about. And that's how the podcast was born. And what you probably don't know is that this is a bit of a passion project. We don't have any sponsors or funding. And without your help, we won't be able to continue bringing you these great guests. So if you can please spread the word about the podcast, share it with someone who you think might benefit from the conversation that you've just listened to, or if you can leave us a review or a comment, it would mean the absolute world, because that actually helps the podcast spread further and get more people to hear our message and hopefully allow us to invite bigger and bigger guests onto the show. And I would so appreciate you helping me back. Thank you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.